Hello, welcome to my YouTube channel, The Curious Mind. Don't forget to like, comment, share and subscribe.
5 years after the outbreak of deadly COVID-19 pandemic that caused over 7 million deaths globally, China is reportedly seeing a surge human metapneumovirus or HMPV, a respiratory illness with symptoms similar to those of a flu. This has sparked serious concerns of another health crisis after COVID-19, prompting neighboring countries to monitor the situation closely. Several media reports and social media posts suggest that the virus is spreading rapidly in the country. Some even claim that hospitals and crematories are being overwhelmed. As respiratory illnesses alarmingly increase in China, there are complaints of congested hospitals and overburdened healthcare systems. Some social media users claim that multiple viruses, including influenza A, HMPV, Mycoplasma pneumoniae and COVID-19, are circulating in China. There are even claims that China has declared a state of emergency, however, there's no official confirmation. HMPV surge in China sparks concern. According to a Reuters report, the surge in respiratory infections, caused by influenza A, Mycoplasma pneumoniae, COVID-19, and now HMPV, has raised alarms. In response, China's Disease Control Authority recently piloted a monitoring system specifically for pneumonia of unknown origin, anticipating a seasonal spike in infections during winter and spring. The report highlighted an upward trend of HMPV cases in northern provinces, particularly among children under the age of 14. Although social media reports describe a critical situation, neither Chinese officials nor the World Health Organization (WHO) has declared a state of emergency at this stage. First identified in 2001, HMPV belongs to the Pneumoviridae family, closely related to the respiratory syncytial virus (RSV). The virus typically causes mild upper respiratory symptoms such as cough, runny nose, and sore throat. However, in young children, older adults, and individuals with weakened immune systems, HMPV can lead to severe complications, including pneumonia, bronchitis, and exacerbation of chronic respiratory diseases like asthma or COPD. The U.S. Centers for Disease Control and Prevention (CDC) notes that HMPV infections have an incubation period of 3 to 6 days, and symptoms may progress from mild cold-like conditions to serious respiratory distress. Is HMPV virus similar to COVID-19? HMPV causes flu-like symptoms. The virus usually affects the upper respiratory system but can sometimes cause lower respiratory infections. HMPV is more common in winter and early spring. While HMPV and SARS-CoV-2, the virus responsible for COVID-19, belong to different viral families, they share striking similarities. Respiratory illness. Both primarily target the respiratory system, causing mild to severe infections. Transmission. Spread occurs through respiratory droplets and contact with contaminated surfaces. Symptoms. Fever, cough, sore throat, wheezing, and shortness of breath are common. Vulnerable groups, children, the elderly, and immunocompromised individuals are at higher risk. Prevention. Standard measures like hand hygiene, mask wearing, and social distancing help curb transmission. However, the main difference between HMPV and COVID lies in vaccination. While effective vaccines exist for COVID-19, no vaccine is currently available for HMPV. Besides this, antiviral treatments are limited for HMPV, unlike COVID-19, which has treatments like Paxlovid. HMPV surge post-COVID-19 pandemic. A study published in Virology Journal in April 2024 revealed in the aftermath of the COVID-19 pandemic, there has been a surge in human metapneumovirus (HMPV) transmission, surpassing pre-epidemic levels. We aim to elucidate the clinical and epidemiological characteristics of HMPV infections in the post-COVID-19 pandemic era. As China prepares for increased respiratory infections in the coming months, experts stress the importance of vigilant monitoring, public health measures, and transparent communication to manage both the spread and public concerns surrounding HMPV.
If you find this video helpful, give it a thumbs up and share it with your friends. For more videos like this, hit the subscribe button and remember to click on the notification bell. Also be sure to check out our other videos as well. Thank you for watching.